A child was brought to the emergency room with an amputated right arm due to a vehicular accident. The patient was severely bleeding and his mother was panicking. Upon rapid assessment, the patient was still breathing and weak pulse was still felt. With this, the healthcare team were still hopeful to save the boy. But after the necessary interventions were done, the patient was still declared dead.
Good morning, everyone. Thank you for coming here today for the stress debriefing session. We understand the challenges you've been facing, and it's important to provide a space for you to share your experiences. I am Mel Jones M. I am the facilitator of the stress debriefing and also a counselor. Today, we are coming together to talk about what happened just the other day in the emergency room. I understand that there was a tragic loss, which I know you face frequently in the area, but this one seemed to really hit hard. So today, we are going to do a little bit of debriefing of what happened. So the way that we will start is that first, we will go around and I'd like for each and everyone to share just a little bit of the general overview of the event based on your experience. So if you don't want to share, or if you don't feel like that you cannot share today, at the moment, that's okay. You can just pass. So is there anyone who would like to start?
I can start. So hello and good morning. I am Nurse Yana and I was on duty in the emergency room when the patient came in. Was a young child, barely 5 years old, who had been in a severe car accident. The scene was chaotic with frantic parents and the child was in critical condition. I felt overwhelmed and helpless, but I had to focus on stabilizing the child. It was heartbreaking to see the extent of the injuries, and despite our best efforts, we couldn't save the child. I felt a mix of sadness and guilt, wondering if there was more we could have done. It was heartbreaking to see the parents' anguish as they waited for the news, even more so when we had to deliver the devastating outcome. We couldn't help but feel a sense of helplessness in the face of such tragedy. It's always heartbreaking to see such a young life lost.
Good morning. I am Nurse Abby. I was responsible for coordinating with the other departments to ensure everything was in place for the patient's arrival. When I heard about the incident, my heart sank, knowing the severity of the situation. Despite our best efforts, the outcome was still tragic. Witnessing the grief of the family and my colleagues was incredibly difficult, and it weighed heavily on my mind in the days that followed. I know to myself that it was a hard experience, but to cope with this incident, I always find time to have breaks when I could. Talking to my colleagues and reminding myself that we did everything we could for the child helped me cope.
Hello, I'm Dr. Charmaine Cariaso. I was called in to assist with the resuscitation efforts. Seeing the extent of the child's injuries was shocking. And despite our best efforts, we were unable to save him. As a physician, it's always difficult to accept the loss of a patient, especially one so young. I felt a mix of emotions: sadness for the family's loss, frustration at our inability to change the outcome, and a sense of heaviness knowing that this is a reality we face in our profession. But as a physician, I need to cope with situations like this, for me to clear my mind so that I can attend to my patients. So as a way to cope with this incident, I rely on my team for support. And I realized that having a support system has been crucial in coping with difficult situations like this.
Hello everyone, I'm Yvette de Santos and I was also present during the incident. I remember feeling a surge of adrenaline as the child was rushed in and immediately went into action mode. Assisting with the resuscitation efforts, it was challenging to stay focused amidst the chaos, but I knew that every second counts. When we realized that we couldn't save the child, it was like a weight crashing down on me. I felt numb and emotionally drained, questioning if there was anything more I could have done.
Good morning, everyone. I'm Jayvelle Domingo, and I was also involved in the response to the incident. Seeing the child's injury was incredibly distressing, and I felt a sense of urgency to do everything possible to save them. Despite our efforts, the outcome was tragic, and it hit me hard. I couldn't shake the feeling of sadness and helplessness, wondering if there's something we missed or could have done differently.
Hello everyone, I am Eduard James Estabillo, and I was part of the team caring for the child in the emergency room. When the child arrived, it was evident that the situation was dire and we all sprang into action. I felt a mix of emotions, fear, sadness, and determination to do everything in my power to help. Despite our best efforts, we couldn't change the outcome, and it was devastating. I struggled with feelings of guilt and questioned if there was more I could have done.
Good morning, everyone. I'm Shawie, and I was on duty during the incident in the emergency room. When the child arrived, the atmosphere was tense, and we knew we were facing a critical situation. I focused on my task, trying to block out the overwhelming emotions swirling around me. Despite our efforts, we couldn't save the child, and it was devastating. I felt a profound sense of sadness and helplessness, wondering if there was anything more we could have done.
Good morning to each and everyone. I'm Eliza, and I was also present during the tragic incident in the emergency room. When the child arrived, it was evident that they were in critical condition, and we worked quickly to stabilize them. Despite our best efforts, the outcome was not what we had hoped for, and it was difficult to accept. I felt a mixed emotions, grief, guilt, and a sense of failure. To cope, I relied on my faith for strength, leaned on my colleagues for support, and made sure to prioritize self-care in the days following the incidents.
Hello everyone, I'm Dr. Diwata Casilla. I was the one who had to break the news to the family that we were unable to save their child. It was one of the most challenging moments of my career. The look of devastation on their faces will stay with me forever. I felt a profound sense of sadness and empathy for the family as they navigated this unimaginable loss. These moments remind me of the fragility of life and the importance of cherishing every moment.
Good morning to each and everyone. I am Cesar Bancifra, a social worker. I was called in to provide support to the family after they received the news of their child's passing. The grief in the room was palpable, and my heart went out to them as they struggled to come to terms with their loss. It was challenging to find the right words to offer comfort in such a devastating moment. I felt a deep sense of empathy for the family and wished there was more I could do to ease their pain.
Thank you all for sharing your experiences. It's clear that this incident has deeply affected each of you. Now, let's take a moment to discuss some coping mechanisms. Nurse Abby mentioned taking breaks and talking to colleagues. Dr. Charmaine mentioned relying on their team for support. Also, others say relying on their faith for strength and prioritizing self-care in the days following the incident became their way of coping with this stressful event. These are all important ways to cope with the stress and emotions that come with working in healthcare. Does anyone else have coping mechanisms they'd like to share or strategies they've found helpful in dealing with difficult situations like this?
I find that taking some time for self-reflection helps me process my emotions, and thoughts. It's important for me to step back and acknowledge what I'm feeling before moving forward. Additionally, I took breaks when I could, talked to my colleagues, and reminded myself that we did everything we could for the child.
To cope, I relied on my team for support, talked through my feelings with a trusted colleague, and made sure to make some time for self-care after my shift. I found that seeking professional support, such as counseling or therapy, can be incredibly beneficial. Talking to someone outside of the workplace who can provide guidance and support has been instrumental in helping me navigate difficult situations.
To cope, I lean on my colleagues for support, share my feelings with my supervisor, and engage in activities outside of work that help me unwind and process what happened. I find comfort engaging in activities outside of work that bring me joy and relaxation, whether it's spending time with loved ones, exercising, or pursuing hobbies. Having outlets outside of work helps me recharge and maintain perspective.
One coping mechanism that has helped me is practicing mindfulness and meditation. Taking a few moments each day to quiet my mind and focus on the present moment helps me manage stress and maintain emotional balance. I also sought support from my colleagues and found solace in spending time with my loved ones outside of work.
To cope, I turned to my colleagues for support, engaged in self-reflection, and found comfort in the knowledge that we did everything we could for the child.
As a social worker, I often find comfort in the act of helping others, volunteering in my community, or offering support to colleagues in need allows me to channel my own experiences into something positive and meaningful.
These are all excellent coping mechanisms. Is there anything else anyone would like to share before we wrap up? Okay. It's important to remember that everyone copes differently. So finding what works best for you is key. Remember to prioritize self-care and lean on your support system when needed. We'll continue to provide resources and support to help you through this challenging time. Thank you all for your openness and willingness to participate in this debriefing session.